Yeah. Hello everyone, I'm Dr. Salman and I have the legends today with me, the digital and the surgical, Dr. Howie Glickman and the Aginini brothers, which need no introduction. It's amazing to have these guys here for an interview, and it's a shout out to them because they have a course coming up on 14th, 15th and 16th of March in Aginini Studios, Italy, Moderna, and it would be amazing with the Ferrari visit. So in total, amazing experience. Plus, you will learn a complete deep dive into the implant field, which starts from the surgical aspects, from the periodontical aspect, and also from the prosthodontical digital aspect. So stay tuned and we'll know more about this. So I'll start with Dr. Howie. How are you?
I'm good. How are you?
Pleasure. Good to have you here. So can you please tell me what will be there in the course on 14th?
So the key factors, as you said, it's going to be a mixture of surgical and digital prosthetics, a little bit of mix of both. And there's kind of like an amalgamation of everything. So it's not dedicated one or the other. It's kind of like a mergence of the whole thing. And from our side, we're going to be doing partial extraction therapies and things like that, which is a very specific niche thing. And we're going to spend a lot of time on that. And that will be the surgical side, going through everything on that aspect from start to finish. And then we move over to the digital side and the restorative side.
So this is a must. You must attend because partial extraction therapy, it's extremely technique sensitive and you need a very good mentor to learn this. So none better than Mr. Glickman. So we'll come to the digital guys. So I have my dear friend here, Andrea, and obviously Alessandro. So we'll talk about the digital stuff now. What do you think now, after 5 years, how the world will be for the digital?
From 5 years from now, most probably digital is going to be like the clinical daily routine. Clinical, surgical, prosthetical daily routine. And what can we say? Just one thing. It's not going to be in our clinic. It's going to be in the Ferrari factory, the course. It's a little bit better than our clinic, I have to say. And yeah, we're going to deep dive, try to give you like some recipe on surgical, prosthetic, and
tips and tricks also, no? Tips and tricks in prosthetically digital workflow to deliver in correct way, the final restoration through the provisional restoration, copy paste, digital copy paste.
Yeah, we're gonna, and as Awi was saying, we're gonna blend together both experience, but most important, we're gonna have fun because it's education and fun. So great experience. We're gonna drive a Ferrari. You're gonna do an F1 pit stop, actually changing the tire.
Yeah.
So also that is tactics.
Also,
I can tell you that.
That's very technique sensitive.
So that's it. That's basically it.
So mark the dates, 14th, 15th and 16th of March, Moderna, Italy. And it's an amazing course with an amazing prize because you're not going to learn anything which is mediocre. You're going to step up, level up in your surgical aspects. And trust me, it will change the game. These guys, like, by the way, you have the book.
Yeah.
Bring the book.
Not here, but I have the book.
This book is amazing. It was a gift from both of them. I can't stop reading it. So it's an amazing book. And there's one more thing. Especially for the partial extraction therapy, there are lots of guys who are so-called trainers in them, but you have to be with the expert to learn it. So can you owner of the technique? I suppose you can't patent the techniques, right?
Firstly, I'm not the owner at all. So let's just take that. But I think the key factor is you said it is technique sensitive. I would say it was technique sensitive. I think the digital workflow that's been created around it has made it predictable and reproducible. And that's the key factor. We're going to go through that, and that's where the emergence is going to come, is how we work from facial design into the surgery, back to the prosthetics and everything like that. And together with that, with the experience of trying to change the tire, which I did and failed miserably. Okay, it's an insane experience. And I think it's come along and join us. Going to be absolutely incredible.
So I'm going to ask one more key question from all the experienced guys, because you will not find the experience like this anywhere else. What is your take on failures?
We all have failures. We need to learn from our failures. We need to document our failures, and we need to talk about our failures more than anything else, because our failures tell a story, and our failures help us learn.
That's good words. That's amazing. That's really amazing. Now, from the Agenini guys, like, what is, like, how for young guys, how do you want to go ahead and adapt digital in the clinic? Because lots of guys are still stuck with the analog workflow. How can you do it? Like, for sure, you have to come for the course for this, but just take a tip.
Well, first of all, you have to change the mindset, most probably.
For sure, but it's important to start with an analog, the analog skill, but and then acquire the digital and the technology, and through the technology deliver in more efficient way your workflow.
And do one change at a time. So if you do too much changes, you're never going to be digital, you'll never succeed. But you do like, okay, I want to digitalize that piece of my puzzle, do it. Once that is working, move to the next step. So that could be a good take-home message, but we will discuss it.
So there's one more, like, from the surgical aspects, take-home message.
I think upskill yourself. If you want to do implantology, you have to be good at everything. You can't be good at one. You can't be good at soft tissue, not at bone. You've got to be good at bone and soft tissue. So upskill, learn, as I think it's exactly the same as the digital. Learn from multiple people, from multiple specialists, because each thing might work for you. And a lot of times you grab a lot of different information from different people and you create your own brand, your own technique. And I think that's important.
That's great. So can I ask you something controversial?
Sure.
The best implant system in the world?
They all work.
That works in your hands. So again, controversial questions. Time for controversies. Best implant system in the world?
They all work. Or come to
Good
the
one.
course.
Yeah, come to the course. You learn. Thank you so much.
He's playing for the show. Yeah, exactly.
Thanks.
I would visit you in Tottenham.